So welcome to this UQ information session about the current COVID-19 outbreak. My name is Dr Kirsty and I'm a virologist here at UQ. And today I'm joined by, of course, world famous immunologist Professor Ian Frazer, who's going to be talking to us a little bit about some of the questions that the UQ community is posing around this outbreak. And what we really want to try and do is just answer people's questions and explain some of the science behind what's going on. So maybe let's start with a little bit of a summary of what's going on with COVID-19. What is it? What's the current situation?
Thank you. COVID-19 is a coronavirus. We know quite a bit about coronaviruses. They've been around for a long time. Some coronaviruses in humans cause common colds, and we've had two outbreaks of coronavirus illness more recently, SARS and MERS, which have not gone as far as this particular virus has spread, but nevertheless were clearly causing quite serious illnesses.
So we've received a lot of questions about this COVID-19 pandemic from the UQ community. And I think probably the best way that we can do this is really address the top 10 most common questions that people are asking and that's on people's minds. So to launch into it, the first question that's been proposed is people want to know, is it possible for somebody to have the virus and not to have any symptoms and then spread the virus? And if so, what do we do about that?
Well, first of all, people are most infectious when they've obviously got symptoms, and that's when they're most likely to spread the virus. But we have to acknowledge there's a possibility that they'll be infectious for a couple of days before they develop symptoms, and there are people who get the virus and never get symptoms and probably shedding virus as well. So that's why it's really important that we follow the guidelines that we've been given to protect ourselves. One of those obviously is to avoid large crowds because there's more chance that somebody in the crowd will have the virus. But perhaps more practically for most of us, what is really important is this business of social distancing. If we keep far enough away from somebody, then it's very likely that even if they are shedding virus, we won't get it. Obviously, close intimate contact is likely to spread the virus better. And the other thing we have to remember is that you actually need quite a long time of contact to significantly increase your risk of getting the virus. So that if we can keep 1.5 meters away from people, if we can wash our hands, not touch surfaces which are likely to be contaminated, make sure that other people do the same, and just politely remind people that we're not going to shake hands at the moment. Thank you, we can namaste if we need to, but keep a distance. That will be the best way we can stop this rapid spread of this virus through the community. And that's what's really important at the moment, because we want to stop the rapid spread of the virus so that we don't have a problem with the health system being overloaded.
And I think that's exactly the point, that, we actually have an opportunity to intervene here with social distancing. So with other viruses, the situation can be much worse in that the individual can spread most of the virus when they're asymptomatic. That doesn't necessarily appear to be happening in this COVID-19 outbreak, and this really gives us a point of intervention for social distancing. So you're not going to catch the virus if you just walk past somebody who's potentially infected. It's really more about, as you say, that intensity of contact and the duration of contact with the individual.
Yes, we have pretty good data on that now, and we recognise that that's probably the most important thing. Keeping reasonable distance from people protects you.
Excellent. Very fair point. So I think that sort of leads on to the next question that people have. And this is really about how long the immunity lasts. So if somebody contracts COVID-19 and recovers, can they get it again?
There have been a couple of reported cases of people who have had the virus apparently twice. We don't really have enough data to answer that question fully yet. We know from other coronaviruses that immunity does follow infection, but it's not long lasting and it's not totally robust. So it's quite possible that down the track people might find that they are susceptible a second time. More importantly, we also recognise that the immunity will give partial protection against the severity of infection. And though you might get it a second time, the second time would be much likely to be much less serious than the first time around.
Yeah, and I think that's a really good point, that this is a novel coronavirus, and so we haven't had the virus circulating long enough in the human population to definitively answer that.
Yeah, well, one of the things that we haven't really got is good long-term data.
Exactly.
So we're really modelling back from the coronaviruses that we've experienced before. And what we recognise from them is firstly that the infections tend to become less severe with passing time. As the virus passes through more people, it becomes weaker. And while the virus may still be infectious, it may not cause disease. And eventually the 2 previous outbreaks we've had have just died out.
All right, so again, along the lines of disease transmission, the next question that we have is how long is the incubation period for the virus, and really how long are you contagious for?
Well, we recognise that people can get symptoms as quickly as 3 days after being exposed to the virus, and as long as 28 days, but much more commonly it's about 7 days.
Yeah. And the contagious period, it's most contagious when you're infectious during that period?
When you've got symptoms, it's when you're shedding the most virus, but there's a possibility you might start shedding a little beforehand, and it's a possibility you might continue shedding a little bit afterwards, because we don't know entirely about that area yet.
Yeah, and I mean the human population is quite diverse, so there's a lot of nuances that need to be acknowledged. Now, the next question is something very dear to my heart, because this is something that we work on, so I might even start by answering this and then feel free to jump in and add any information. This question was asking who is likely to be most severely impacted by the virus in the community, and how can we protect them? So this is really looking at sort of the vulnerable patient populations. And what we know from all the clinical data is the vulnerable individuals tend to be those who are elderly. People living with diabetes is another susceptibility group, those with hypertension, chronic respiratory conditions. And a lot of people are asking about if you're pregnant or not. Are you more susceptible to the virus? Because that happened in the 2009 swine flu outbreak. The evidence that I've seen is that there's no real clear-cut indication of increased susceptibility. Would you agree with that, Ian?
Yes, I would agree with that. I think one area that we're really not completely clear about yet is those people who are taking drugs that might damage their immune system as treatment for cancer, for example, or an autoimmune disease, and whether they become increasingly susceptible not so much to infection but to becoming ill with the infection. And this, I think, is something that we're going to have to look out for and learn from, particularly in relation to HIV/AIDS.
That's a really key point, because we know that given our world population at the moment, there are a lot of people living with one or more condition that require them to be on some level immunosuppressed. So this will be something really important to answer in the future. Oh, this is a big question. So the next question is, what percentage of the population is likely to be infected with COVID-19?
Being realistic, and given that this virus is spreading epidemically at the moment, I think eventually, over the next year or two, almost everybody on the planet will be exposed to this virus. Of course, that does not mean they're going to get sick with the virus. It just means that they will have seen it and either fought it off, or they've gone on to get the minor symptoms that we expect for the vast majority of people. So maybe 95% of people on the planet will get this infection and never know they've had it, or have only a mild sniffle or a slight cough or fever. Obviously, it's the other 5% that we're trying to protect by the various measures we're putting in place, particularly social distancing.
Yeah, and I think that is a really key point, that people will eventually be exposed to this virus, but what we're trying to do now is make sure that if they're exposed, they're not going to get severe disease, and they're not going to be in a situation where our healthcare system is so overwhelmed that they can't be adequately cared for.
Yeah, this is the critical thing. This is the measures that the government have put in place that will basically slow down the spread of the virus through the community. And that will mean that those vulnerable people who may well end up getting sick whenever they get the virus, they're not all in the hospital at once, and therefore we've got time to manage all of these people with good resources. This has been the problem that's occurred overseas, particularly in Italy and France now as well. The system has got overwhelmed with patients because there's been a very rapid spread of the virus, and we want to make sure that does not happen here.
Yeah, exactly. And I think the other thing just to consider is that, you know, we are coming into our flu season, so our healthcare system can be overstretched. So it's really up to us to do everything that we possibly can do to try and relieve that pressure on the healthcare system. And as you say, social distancing is really the key here. All right, so this is another thing that I think is on a lot of people's minds. If you're out and about, should you wear a face mask?
Short answer is no. The sort of thin, cheap face masks that are more readily available are effectively ineffective after 20 minutes of wearing them, so you'd have to carry a very large pile around with you. And it isn't the right way to stop the spread of the virus. Social distancing is much more effective than wearing a face mask.
100% agree. And I think the other thing to note there is that we are running into a situation where we want our healthcare workers to be protected as much as possible. So if you're going and buying up a lot of masks, that's potentially taking them away from healthcare workers who are really on the front line of this pandemic. All right, so this is a bit more of a scenario question. So if I am currently under quarantine after being in contact with a confirmed case, how come my husband and kids are not? Couldn't they be spreading the virus if I'm currently carrying it?
Well, first of all, you would have to be currently carrying it. And secondly, you would hope that even in that circumstance, social distancing would protect the rest of the family. And then on top of that, realistically, people are going to be exposed to the virus eventually, and quarantine is trying to reduce the spread within the family or outside the family, but it doesn't actually act as a complete stop.
That's exactly right. And it comes back to that point you made about just slowing down the spread of this disease and ensuring that it's manageable.
Absolutely.
All right, so this is something that's come up in the news a lot, and in particular in the UK government's policy towards this pandemic. And so there's lots of talk about herd immunity. Is this possible without a vaccine?
Yes, in time that's what's going to happen, as has happened with other coronaviruses in the past. We will gradually become immune as a community to it. Through reinfection, we'll boost our immunity, hopefully without getting sick. And eventually this virus will fade into the background of people's minds because it won't be causing much illness. Obviously, it would be better if we could get a vaccine, but realistically, we have to accept that that will not happen early in the course of this epidemic. If we get it at all, it will be a year or two before we have one.
And again, that relates back to that slowing down factor, because if we can slow down the number of cases, it buys us time that potentially, hopefully, a vaccine could be developed or something could be developed.
Yes, particularly likely would be that there will be some intervention that we can give to people who have got the virus and are becoming ill. That takes time to develop. We have to do research on that. It'll probably happen more quickly than a vaccine. But again, if we slow the epidemic down, the chances are greater that people will be able to get some specific treatment when they get the virus.
Yeah, 100% agree. So I guess some of the things I hear a lot as an influenza virologist is people comparing this to the 2009 swine flu pandemic. And people saying, well, how did we overcome previous pandemics like the H1N1 swine flu pandemic with the development of a vaccine? And why can't we do that here?
Well, obviously we would like to develop a vaccine. I think it would be fair to say that most epidemics of flu just burn themselves out eventually. The vaccines are probably helpful to some extent because they stop people getting seriously ill. But interestingly, the most vulnerable people are the people who are least well protected by the flu vaccine. And so the elderly and the people with immune compromise are the ones that will get the vaccine and still be at risk of getting the virus. The flu is very different. It changes. Each year we get a new flu virus, and so that our body isn't used to the new flu virus at all, and so the herd immunity component isn't really there. And sometimes we get a particularly nasty flu virus and we get a big epidemic, 2014 in the UK, where there was something like 25,000 deaths attributed to the flu virus. In other years the flu virus is much milder, and we get, in the UK it was about 1,000 deaths.
Yeah, I feel compelled to answer part of this as well, because as a flu virologist, this is what I do. So I think the other thing that we really need to remember is that even when we get a new strain of flu, like what happened in 2009, our immune system has already seen at least some other flu virus. So most people have been exposed to flu by the age of 6. So there is at least some level of pre-existing immunity. Even if it's not perfectly matched to that new strain, there's potentially some pre-existing immunity. Whereas with this coronavirus, because it's completely new in the human population, we don't have that pre-existing immunity. So that is partly why we're seeing a lot of these cases.
Absolutely. I mean, the problem at the moment is this is a new experience for our immune system. We've seen coronaviruses before, but not one that looks like this one. I mean, they come in different tribes, if you like, and this is a new tribe.
Yeah, exactly. All right, and I mean, the final top 10 question is something that I think everyone is asking. How important is vaccine development, and How, when are we going to get there?
Well, look, vaccines are the single most effective public health measure that we have, and people should get all the vaccines that we can offer them because they reduce the burden of infectious disease in the community. Look, we've had plagues in the past, we've had epidemics of very nasty virus infections in the past that have been much worse than COVID-19 looks like it's going to be. We've managed to conquer many of these diseases through vaccination, and it would be, of course, very important to get a vaccine, particularly to help the vulnerable people who might be more likely to get sick. But as we've said already, this is not going to be something that's going to impact this year. Maybe and hopefully next year we can get a vaccine that will be reliable enough to reduce the burden of disease.
Yeah, and I think vaccination really comes to the heart of this issue, because I've always viewed vaccination, in particular in the case of flu, as one of the most altruistic things you can do, because it's not necessarily, I don't get flu vaccinated for myself, I get it to protect the contacts that I have that are susceptible. And it's really the same thing with social distancing here. Whilst you may not personally be in a risk group, I'm sure every individual has somebody in their family or somebody that they care about that they would like to protect. So that again comes back to, if you can make these small changes in terms of social distancing, you are potentially really protecting the vulnerable members of the community.
Yeah, I have to agree with that. It really comes down to this business of following the advice that we've been given about not having big gatherings of people together, which obviously give the opportunity to spread the virus, and keeping our distance from other people. We know that if you're 1.5 meters, 2 meters away, this is a virus that's spread by the stuff on your fingers going into somebody else's mouth effectively, and if you can prevent that happening, you basically reduce the spread, which is what we're trying to do.
So I think when you put a virologist and an immunologist in a room together, we could probably talk about this all day quite comfortably, but I think we're going to try and keep this quite brief so that people can follow and people are up to date with the advice. Is there any final message that you would like to give people about this COVID-19 outbreak?
Yeah, don't panic. Just get on with following the advice, and we will do what we can as virologists and immunologists to protect you against the infection in due course.
That's exactly it. We will get through this. We've just got to not panic in the meantime.
Absolutely.
Thank you very much.
Thank you.